Hello, I'm Alex Gill. In actuality, I started, even though it was hot outside, I used to get cold all the time. And my stress began to decrease, and I lost my appetite, and my bowels were not moving. I was not going to the bathroom as well as I should have been. So I knew that there had to be something going on in there, but I couldn't exactly tell. And I know my body better than anybody else. I'm a pharmacist by trade, so something was not right. So I decided to come here to see if someone can help me correct my problem. Well, actually, I was watching a show on cable, and it happened to be one Saturday, and she was going over different types of hormone replacement therapies. And I, at that point, decided to make an appointment to come here. You know, I go to a primary care doctor, but I thought she would enhance my life a lot more than what I normally have had. And there were some changes going on in my body, and I didn't understand why they were going on, so I needed somebody to exactly help me raise me up from where I was. Well, I came here, you know, they greet you in a nice manner. I got to meet Dr. Patty. We discussed my symptoms, the things that I was having and things the way I was feeling. Then she sent me out to obtain blood work because that's actually going to tell what you're deficient in and the improvements that you have. So after the blood work came back, then it was noticed that my testosterone was down. Also to my, my B12, there's some other things that I had. My thyroid levels were down. So at that point, then we went about laying out a plan to actually help me feel better. I, come here every 3 months. I get my blood work done. I started eating more. I had more energy at my job because some days I work 14 hours, and I'm up every day at 3:30. So I usually could work when I was a boy. You have more energy than when you're a man as you get older, but I usually never got tired. So after we started getting me on the different types of supplements, going over my diet, putting me on the medications, and getting more sleep and reducing my stress level, things began to improve. Some people get up in the morning and they're dragging. They need coffee and so forth. I don't generally need to do that. With the way things have been for me since she's tweaked my body back to where I wanted it to be now, I'm able to just literally get out of bed, start ironing my clothes, putting my stuff together, and then I get out of the house at 6:50 in the morning because we have to have a meeting before we start work. And since I've come here now, I've been able to actually work from 7 to 9 at night, and I'm not even tired after I get off work, whereas before I was like, I was just dragging along. You need an energy drink or some coffee. I don't require that. Strength began to come back. My bowels began to flow, and I used to get cold all the time, as I mentioned before. I actually began to, when I go into a cold room, I wasn't as cold as I normally was. Most doctors that I've dealt with, they go through or utilize drugs to make patients feel better. Here, they start from the ground up. It's as though you were building a building from nothing. Drugs aren't always the answer. There's some nutritional things here that I have patients that I deal with, they're on 15 drugs. That's more drugs than they take than meals during the day. I see a problem with that, even though that's how I make my living. But in society, you open a magazine, you look at TV, there's always a commercial for a drug. Well, this is a business, and I understand people have to make money, but there's alternatives to that. And I use both if I have to, but I want to start where what I put in my body is what I get out of it. If you're having any problems and you've discussed things with your primary care doctor and you're still not getting the results that you need to have, and that you still have doubt in your mind as to whether or not there is something else that I can do to help myself out, I recommend that you come to the SaJune Medical Center.